I'm Dr. Kimberly, owner of Holistic Healthcare Centers, and I have the pleasure of being with my amazing patient, Sarah, and she's going to tell us a little bit about her journey with Holistic Healthcare Centers, which began in May 2020, which, of all times, began.
Yay, COVID. So I have been a patient here at Holistic Healthcare Centers with Dr. Kimberly, dealing with fertility issues. And that was the reason that I originally came in. My husband and I had been trying to conceive for almost a year.
And you were a teacher, or are a teacher, which amped up stress.
Yes. So my stress levels were high. I was seeing a fertility doctor as well. But as one last step before we started IUI, I really wanted to try acupuncture because I had heard a lot about it and some people I knew had had success. And so I did a Google search and ended up finding Dr. Kimberly.
Hey.
I came in for my first session in the beginning of May 2020 and actually ended up getting pregnant on that first cycle after a month of acupuncture, which was just unbelievable to me.
We're so happy for you.
And so I really had success, not only with conceiving, but then throughout my entire pregnancy with you. I had terrible morning sickness.
Oh my gosh, it was, yes. But do you feel like, I'm going to actually take one step back.
Yeah.
With fertility, the treatments to help in fertility, were they painful? Were they comfortable? Like, what was your experience with that?
So I didn't know what to expect because acupuncture I'd never done, and I had no pain at all.
Yeah.
It was totally pain-free, and I think that a lot of people, when you think about sticking needles in your body, you're not sure what it's going to be. I actually ended up doing electroacupuncture.
Yes, yep.
So you think about needles and
electricity,
and you're like, what's going to happen? But I think it was one of the most relaxing experiences. Every time I would come in, I looked forward to it because it's not painful. You know it's for the benefit of your body and hopefully your future family. But everything from insertion to laying at the table and removal, there's no pain.
That's very good. I think people always wonder about that.
Absolutely, and I did too. I was just like, what is going to happen? But right after my first session, there was no pain, and I looked forward to it.
I still remember the day of you coming and telling me that you're pregnant, which was so exciting, so very exciting.
Oh my gosh, and I think you were one of the first people I told.
Which is very also exciting.
Because we had talked about how there was kind of a little difference in my body the week before, but you didn't want to say anything.
No, as a provider, I never want to like get the hopes up. What if it's just a hormonal shift? So I do my best to kind of just stay neutral but supportive.
Absolutely, and you were such a great support. And so I think I got my positive test on Tuesday and came in and saw you on my usual Thursday.
Yes, and the front desk knew because I got so excited for you.
We were all screaming and jumping up and down. And yeah, it was just a great day.
That's awesome. Well, and then, so in your journey, you did wind up getting some morning sickness, and we do here at Holistic Healthcare Centers have beds that elevate and tilt and heat, or like we have ones very specific, especially for patients who become pregnant. With the morning sickness, and then you also got congestion.
Yes.
Did you notice any change after you'd get acupuncture? Did the nausea decrease, increase? Anything happen with that? And then the next question would be about the congestion.
Yes. So I think, you always hear about morning sickness with pregnancy, but no one told me about pregnancy congestion, which was a thing. And so I was feeling just completely the worst congestion of my life.
Because estrogen increases the congestion. It has the ability to increase congestion.
So I had a running appointment every Saturday through my whole pregnancy. And when I would come in on those Saturday mornings, by the time I would leave, my sinuses, I would feel them completely clearing, and my nausea would be a lot better. I had a very elevated case of morning sickness, so I also was on a medication.
Yep. Which, for patients to know, that was something that I was very supportive.
Yes.
And I actually told you to talk to your doctor about it.
Absolutely.
Acupuncture helps greatly, but we only want to subdue things like the nausea, with the points of the nausea to a point, because if we work to subdue it even stronger with an acupuncture standpoint, if a patient's not having complete relief, then we start to impact the hormones. We don't want to impact the hormones. We just want to use things like pericardium 6 and other points to help decrease the nausea. So as a provider, I know that, all right, if we are at this point, and I would say your nausea probably got about 30%, maybe 40% better.
Oh, yeah.
But wasn't gone, and there's no reason to be miserable. And there are some medications out there that are very safe, that, first line of defense is this, and then we sometimes find that we partner the two together. Absolutely. And then you can share what happened after that.
Yeah, so it was truly a perfect blend of Eastern and Western medicine, because I had my little medication that I would take just to ensure that I was able to eat and be okay. But after acupuncture sessions, it was like I felt like myself again. I felt more normal.
Your color would change.
Yes, I would have some color in my face. I wouldn't have that drain feeling because I was so sick. And then my congestion would be gone. So in my running Saturday appointments, I would feel great, and then around Thursday evening...
Yep, so that would be Saturday.
Yep, and then that whole week I'd feel good, and then around Thursday evening I would be like, oh, it's time for acupuncture to be coming up, and I knew that in a day and a half I would be back and be okay then. So it lasted. It was not a short-term thing. It lasted me the week in order to work and function.
Right.
Which was great.
Which, again, like, with this kind of situation, it's kind of like if somebody's a personal trainer and has back pain. We can't stop the everyday activities that are creating the back pain, but we can decrease the pain and help them function better. With pregnancy, you were definitely prone to the nasal congestion due to the estrogen changes and so forth. So we're not going to try to stop the estrogen changes. We want to keep that. Right. We're at that point, we're doing like what's called branch treatment. We're just treating the symptomology, but not the root cause of it.
And it was so great because as a teacher, I didn't want to sound all congested and terrible when
especially during the pandemic.
Especially during the pandemic when I'm teaching online anyways. And so I was clear and functioning all throughout the school week.
Just awesome.
Which was so great, but still knowing that it was safe for my pregnancy.
Yes. Well, and then let's go to that time where many patients, every woman I think that's ever been chosen to have a baby can be very nervous about labor and delivery. Can you tell us a little bit, do you feel like acupuncture made any impact? I know that we were doing things to kind of help move the chi and blood. We can't induce or anything like that with acupuncture, but we can just help your body be ready and help the pregnancy, if it's ready to come, help it along.
Absolutely.
Or the labor and delivery, I mean.
Right. So I was a nervous wreck about labor and delivery, no matter how many classes I took, how many books I read. As a first-time mom, that's just kind of
everyone.
What happened.
I was the same way.
Yeah, and all my friends, everybody. And so I knew that I wanted to get my body prepared as best I could for this momentous occasion. And so I think in about 38 weeks.
It's 39,
39 weeks, we were good. The baby was looking good and healthy. And so we knew we could do some kind of induction points or things. Also, I think anxiety we did.
Yes, exactly.
Because I was so nervous. And so I just felt prepared. My body, I knew, was ready. I really felt like everything was in sync. And then our labor and delivery story is kind of crazy, but my water broke at midnight on my due date.
Which is awesome. I think you had two, and we never call it inducing through acupuncture, but I think you had 2 treatments where we call it like moving the chi, moving the energy, and it's just basically if a woman's body is ready to go into labor, it's going to help support that aspect of it. And so we did these points and did this type of treatment that helps with supporting labor and delivery. And I think it was after 2 treatments that your water broke. And I mean, not here.
No, it was not here.
And then go on. Sorry.
Yeah, no. So I really think that my body was just ready at that exact 40-week mark.
Which is also pretty big for a first-time pregnancy. Sometimes it can go into 41s and you have to have pharmaceuticals intervention and things.
Yeah, and I didn't have to have that at all. And So it was just kind of a very easy transition, and I was blessed with a very good delivery. I credit you for a lot of that with getting my chi in motion and my body ready to do.
And I love that you use the term chi.
Which I never heard before I came here.
Chi is energy.
It's your energy and your flow, and I just lucked out. We had a very successful, good delivery. And I think a lot of that was because my body was prepared in a way that you can't do any other way than acupuncture.
And I do think, and it was great that you kept your consistency of coming. And then fast forward, your postpartum, since labor and delivery was easy, didn't really need to come back and have acupuncture, have a beautiful baby girl named Chloe. Yeah. But then a few weeks ago, you contacted us because what happened?
So I have been having some issues with mastitis and clogged ducts while breastfeeding. And I have already done 2 rounds of antibiotics with my OB, who is amazing and wonderful. But my mind kept coming back to what else can I do to prevent this from happening, because it's happening frequently. It's extremely painful.
You'd already used cabbage leaves and every possible.
Cabbage leaves, heat massage, hot showers, everything. I had done everything and was still getting them. I'm just prone to them because of my anatomy. And I thought, I need to call Dr. Kimberly. Like, why haven't I thought of this before? And so we started treatment for the prevention and actually helping with a case of mastitis, which if any of you moms know about that, it is one of the most painful experiences of my life.
Yeah.
And we have just found so much success, again, with acupuncture.
Which is pretty exciting, like, just because when Sarah, do you mind if I share a little bit of details?
No, go ahead.
When Sarah first came, she wasn't even aware of it, but on her, what was your left? Yeah, on her left breast area, there was inflammation starting. And she wasn't even aware, just because you're a nursing mom, you're busy. So we did a treatment for that and decreased it. She came back and she had a plugged duct on the right side, and we noticed, we thought everything had kind of calmed down, so we did an exam, and I noticed that there was redness now on the right side, and this one was even more intense, with like a red pathway going into that nipple region.
And that's bad news.
Yeah, that was like, and so we did a very, very strong treatment, couple of different modalities with it. And then my advice was, if it gets worse, you got to call your OBGYN.
Yeah.
If it decreases, then great, come back in a couple days. And not only did it decrease, but the little blister, the block that was a clogged duct in the nipple region. You're gonna share what happened?
It's just clear. So I had a milk bleb, a nipple blister. It was painful. It was causing, obviously, the blocked duct. And before I wanted to see what you could do about it, and it cleared, which is amazing.
Great, yeah, because we both said, okay, anything goes on, call your doctor on Friday, your OBGYN doctor if it doesn't get better, and if it's still present when you come on Saturday, you need to go into your appointment on Monday, because here at Holistic Healthcare Centers, we're very integrated. Absolutely. There's a place for all forms of medicine, so it's never just here. It's a team effort of all forms of care. So so I'm so glad, and hopefully that was the last of the mastitis issues.
So now we'll do prevention for any mastitis or clogged ducts as we continue my weekly appointments. But absolutely what Dr. Kimberly said about that mesh of your normal healthcare provider, especially if you're pregnant or trying to conceive. We did see a fertility doctor who was also in sync with acupuncture. And so it's a combination of care. It's not one or the other. And I think that is what was so beneficial for me in a healthy pregnancy and being able to conceive. And then now these continuing issues with breastfeeding, but finding success with that, which can be hard.
And then that's where Sarah and I discuss a plan. What is her, does she want to continue to breastfeed? Does she want to stop? What is her comfort level? And what then we can do together to support if her desire is to continue, like if her desire is to continue, what we can do, if her desire is to wean off, what we can do. So it's very much a collaborated team effort, and at least with acupuncture here, it's very much individual based. was the day that I treated you for mastitis. I literally had another patient in a different room I was treating for mastitis, and the points and the needles were very different. And I had 2 fertility patients that I was treating, and both of those fertility patients were being treated different, so it's very individualized.
Absolutely.
Yeah.
And I think what I love so much about coming here is that not only do you know so much about me, and we have such a good relationship and rapport, but everyone that works here, Lisa and Andrea,
loves patients. Everybody.
Yeah, and everyone knows you, and it's really personable. And you know, I know things about your life, and you know things about mine, but it's never intrusive. It's just a really healthy rapport. I think that you have with everyone.
I hope so. I think so. I love
makes a huge
all my
difference.
patients. I think and it's neat because, you know, when you are in, you know, when you're seeing the patient every single week or whatever the case, and fertility tends to be weekly.
Yep.
You get to know who their family. You get to know favorite foods. You get to do all sorts of things.
Yeah, everything.
And then of course, you know, there's conversation back and forth. So yeah,
that's great.
Well.
And I think at first I was like, oh my gosh, for fertility, I'm going to be coming 2 times a week. And then I was also seeing my fertility doctor. But it ended up being, coming here was kind of like therapeutic.
Yes.
Like it would be my time to relax and chill out, which I needed so much with fertility. Because you're so stressed about it as it's going on.
And being a teacher during a stressful... Yes. So your stress level for so many reasons were high, and then the fertility. And a big thing is that with fertility, it's so I mean, fertility, many different types of things, but it's so easy to become on the forefront of your mind at all times.
Yep, never goes away.
And it seems, and what we try to do is, we know we're not going to take it off your mind, but if we can turn the volume down a little bit on it and let you laugh at a funny show, and
and that helps a lot too. And just knowing that you're doing something in addition to trying and seeing your fertility doctor and seeing your OBGYN, you're going another step further, which in my case worked.
Right, and what was great about you is you were very open. You had, like, if I can't do it naturally, then this is step B, and this is step C, and so forth. And luckily, we never had to go to those steps, but you were, you know, coming at it with open-mindedness.
Exactly, and we were ready. We had an IUI appointment, I think the first week of July. We were going to take that step because, like you said, it's collaborative. We didn't have to, but we were going to start it.
Yes.
And you were going to support me through that as well.
Absolutely.
But we
didn't have to.
We got very lucky. So.
Well, thank you, Sarah, so much. I appreciate you sharing, and I'm sure many women out there trying to figure out what they want to do and what their comfort level is are very appreciative to you sharing your story.
Oh my gosh, and I cannot recommend this enough. And like she said, I had no pain with it. If you're scared of needles or of taking that step to make the call, do not be. It is a decision you will not regret. So.
Yes, and if you are our videos are on our website, but they're also on many different social media forums. So if you're seeing this video and you don't live anywhere near our clinic, it's something to look into for sure wherever you are. Some things you want to look for is you want to make sure you have a licensed acupuncturist. You want to make sure they've had added fertility training. So for myself, when I was in school, like my master's degree, my 3 main focuses were fertility, pain management, pediatrics. When I got my doctorate, fertility, pain management, pediatric. And all of my CEUs, that means like the classes you have to take to keep your license valid, I've done lots for fertility. So you want to make sure that you have somebody very well trained, because as much as acupuncture can help, it can also like undo, because if it's impacting the hormones enough to help with pregnancy, you know, it could do the opposite if you don't have somebody well trained. So always look for credentials, look for somebody who's licensed and board certified, and somebody who has had specific training in fertility support. So thank you for listening. Thank you so much, Sarah.
Thank you, Dr. Kimberly.